Hi everyone. I'm just going to wait a few moments for people to start joining and then we will start our live on ankle injuries. Just another few moments and then we'll get started. How's everyone's Monday going so far? Anyone here got any ankle injuries? Okay, great. We'll get started now and then people can just join on as we go through. Okay, today's live is on ankle injuries. This is probably one of the most common injuries that we will see, besides the lower back generally. Um, it can be divided into many different groups and different injuries and different areas and different structures. So predominantly ankle injuries aren't just sporting. They can be from a variety of different issues. For some people, unfortunately, the most common version will be going out, having a few too many drinks and sadly falling off a curb or just falling over. Women predominantly probably being in heels and falling. But it can also be common for people who do running, so they could fall on an uneven surface or on a stone or something and just lose their balance and, as they say, twist their ankle, subsequently rolling it and then sustaining a sprain or some form of other injury. Um, so generally, ankle injuries happen to anyone at any age. It doesn't matter how young or old you are, you can still sustain an ankle injury. So generally for men, it mostly occurs between those aged 15 to 24 years of age. And then for women, it's normally those older than 30. However, in certain sports, specifically netball and basketball, it's very common in women's sports and in women athletes, and also in sports such as football, rugby as well. There's not really any sport that doesn't actually have ankle injuries, and generally it is actually the highest injury that you would see in sport, um, which has been proven by many papers. So there are quite a lot of case studies out there, and lit reviews and seismic reviews as well have all gone through it. So if you'd like any more information about that, we can send you some papers to read, which are very exciting. I obviously won't be going into that much detail about some of the injuries, as I could be talking for hours. But generally, when you sustain an ankle injury, it's normally put into three categories. So normally a sprain, a tendon issue, or a break/fracture. Um, so generally it is defined by what tissue is damaged. So obviously a fracture is an issue with the bone. A sprain is normally ligaments, and a tendon is your Achilles normally. So generally, a bone injury is normally sustained by a very big amount of force being pushed through that area. So it can result in a standard break, so just a hairline, or you can have a very harsh break where unfortunately you could completely break your malleoli, which is very, very common, unfortunately, in contact sports. I myself have seen one or two this season already in rugby on pitch side, unfortunately. Players are doing well, they are recovering. However, they are still in the boot, unfortunately. But when they are out, we will be doing a lot of rehabilitation for them. Sprains are normally described as damage to a ligament. And this is normally when the ankle has gone beyond its normal range of movement. So the most common one is an inversion. So imagine this is the ankle, and the ankle will go in. So you'll have a lateral ligament sprain, which is your ATFL. This is normally the most common one. However, you can obviously have issues in your posterior and also in your medial one as well. But generally, an ATFL sprain is the most common one. Sprains can be severe, they can be quite mild also. So normally they are split up into different grades. So grade 1 is very, very mild. Generally, it's just going through rehabilitation, going through proprioception, ice, and normally go through the RICE principle. So it's resting, ice, compression, and elevation. We'd normally say to do that about 3 or 4 times a day, consecutively for about 10 minutes, and then going through ankle range of movement with a resistance band, which is what I always give all my patients and also athletes that sustain a sprain to do for the first 2 to 3 days, just to start regaining strength of the ligaments. Obviously, you can have a grade 2. So grade 2 is a bit more severe. So normally this one, we will put you in some form of support or a compression band. This is just because the ligament is a little bit more damaged, so the fibers have stretched quite a lot more, but it hasn't fully torn. So generally that's still quite mild, but it's moderate as well. And obviously a grade 3 is a rupture or a tear. So for that one, normally you won't have surgery for an ankle. It would have to depend on whether it's fully ruptured or not, and then obviously the severity of the tear itself, so how many fibers are attached and aren't. With that one, you'll generally then be put into a cast. If you need to be operated on, you'll be operated on. But normally the most severe would be a break. So obviously a break is to the bone. So for that, normally it's very obvious straight away if you've broken your ankle or something around your foot. The swelling will be a lot more severe. You'll have a lot of bruising as well. You won't be able to weight bear at all, whereas with a sprain you are still able to weight bear. So that's normally for us a very big indication as to whether it is a sprain or whether it is a break. So generally with sprains, you are able to weight bear, you are still able to walk, you might still limp a little, but you're able to put a lot more pressure through the ankle. Whereas if you have broken your ankle, normally it might be disfigured, so you might be able to actually see the break. And then obviously generally you won't be able to weight bear at all. You'll have a very sharp shooty pain and you won't want to put pressure through it. So if someone unfortunately does break their ankle, you'll be put into a cast, or you will be put into some form of a boot, and it will be completely immobilized. So generally after that, the rehabilitation is a lot more harsher, just because obviously you need to regain full strength. So for the first few weeks or months, it will generally just be going through range of movement and just general strengthening, not much weight bearing. And then once the break has significantly healed, then about after 6 weeks, then generally you'll start to do a bit more weight bearing, and then going through the movements. So what normally causes these sort of injuries, as I said before, you could be walking on an unstable surface or uneven surface. You could fall, contact, landing really awkwardly when you jump, rolling your ankle, which is the most common one, or twisting it. Sometimes car accidents as well, or you could be running and you just slip. Unfortunately, can't always stop certain things happening. You can't always just stop the outside environment. However, you can strengthen your ankle a lot. So normally the biggest signs, as I already said, for different types of ankle injuries will be the pain and how often you have the pain and severity of the pain. So ankle sprains and tendon issues generally have a little bit less pain than a break initially. But normally if you see a break or you feel that you've broken it, you might not feel it at first. It's normally the shock of it happening. There's so much adrenaline, you won't know that you've broken it until eventually you've looked at it, you're like, oh great, and then that's when all the pain kind of starts happening, and everyone's like, oh my god, I've broken my ankle, and shock kind of kicks in. But generally, if you have ruptured your Achilles tendon, you will feel it, and most people say you'll hear a band snapping and you'll feel it basically shoot up the back of your leg. Unfortunately, it's a very horrible injury, and it's probably one of the worst injuries to recover from. It could take from 6 months to a year to fully recover from an Achilles rupture. You can also have other injuries to Achilles, so you can have tendonitis or tendinopathies, which Joni has previously done a live on. So if you want a little bit more information about the differences between tendonitis and tendinopathies and tendon injuries, then I would really recommend to watch and listen to Joni's live. But I'll briefly go over it. So normally tendonitis and tendinopathy injuries happen because of overuse. So it's a lot more common in runners and people that are just very active as well. It's because of the constant plantar flexion and dorsiflexion. So what happens is you just get a lot of tightness around the Achilles on the back because your gastrocnemius and your soleus are having to work quite a lot harder. So after a while, they'll just generally become quite inflamed. Sometimes they become tender to touch as well. And occasionally you'll have a little bit of swelling. So generally when it does get quite uncomfortable, we would generally recommend you to rest, just to stop any more injuries kind of occurring and then tearing the Achilles. Is an Achilles tendon rupture, as I said, is very severe. So normally if you are feeling your Achilles is quite tight, we'd say to kind of relax, not try to stretch it out too much. The worst thing you can do is overstretch a tendon or a muscle when it's very tight. So we always say to just kind of relax it, do nice gentle stretches and nice gentle movement, but the most important thing is stretching at that point. You can also suffer from dislocations or subluxations at the ankle. So obviously that will occur at the ankle joint itself. It's not as common, but normally if you do break your ankle or your malleoli, then you might have some form of subluxation or dislocation. But generally, because you have your ligaments and your tendons around your ankle, like the knee, it's very strong. So normally a subluxation or dislocation is probably the last form, and it would have to be a very big, great external force in order for it to happen, as it is one of the stronger joints in your body. So if you do suffer with that, you will hear a snap or a pop. And again, like a break, it will generally be quite obvious with the amount of pain that you will feel, and you won't be able to weight bear at all because the ankle won't be in place. So as I said before, if you do sustain an ankle injury, we would always say do the Rice or the Palese principle. So obviously Rice principle is rest. So it's really important that you, if you do have certain injuries, that you do not weight bear at the time, especially with the ankle, as it will take all of your body weight basically. We wouldn't suggest doing it for more than 2 days if it is a sprain, just because then if you start limping and you're not weight bearing enough, you're not really using your ligaments or your contractile tissues around the area well enough. And then ice will vary. Different people will advise different things. I myself personally always say I would ice it for 10 minutes, use a bag of peas or crushed ice, which is preferable, or even just normal ice, and then compress it. So get like a wrap. So if you have cling film or a tea towel, wrap that around it and then hold it on, and then slightly elevate your foot, making sure it's just a little bit above knee height. and do that for about 10 minutes. Some people can do it for 15 to 20. I generally say 10 minutes. And then what I say to people if they've got ankle injuries is then do elastic bands afterwards. So this is just going through dorsiflexion, plantarflexion, inversion and eversion within a band, or you can also use a towel and isometrically hold it. They're both really effective. And what I normally say is for the bands, 3 sets of 15 repetitions for each one. And then if it's the towel, then I say 3 sets of 8 with a 5-second hold for each one. So what's that doing? If you have sprained your ankle straight away, it is helping you to strengthen the ligaments, making sure that it is working and it is repairing itself. The worst thing to do when you have got a sprain is to completely immobilize it, because then the ligaments and the joint itself will become quite stiff, and then it will be harder to kind of move it, and then it will take a little bit longer to do the rehabilitation. So generally that's the normal outcomes. However, if you have obviously sustained a break or you are worried that you have torn your ligament or tendon, we would always advise you generally to go to a doctor to get it x-rayed or an ultrasound or MRI. Normally for us though, we do quite a lot of clinical testing, and we see it quite a lot, so we are quite good at being able to identify whether it's a ligament injury, whether it's a break or a tear in the tendon. However, obviously sometimes if we are unsure, then we will refer you on to have one of the scans just to 100% have a confirmation. But normally with sprains, you don't need to go to a doctor. It's normally just sometimes if the pain's too bad, take a few ibuprofens or paracetamols, which also help with the inflammation, and then just going through the RICE principle and then going through rehabilitation. Like I said, for breaks, generally you would have to go to the A&E or to a GP just to have a full diagnosis and be put into a cast or be given a boot. In terms of treatment for all of them, generally they'll all kind of follow the same sort of process. So always be rest first, and then the rehabilitation will depend on the injury, also the timing as well. So sprains, generally with some people, you can be back within a week if it's only a very mild grade 1 sprain. If it's a grade 2, generally between 3 weeks to 4, and then it depends for a grade 3 on severity of the tear. So whether it's full rupture or if it's just a normal tear, it could take up to 6 months. For tendons, as I said before, 6 months to a year. And breaks can be 3 to 4 months, but sometimes longer depending on whether it is just a clean break and whether any of the ligaments or tendons around have been affected as well. But generally, we always start with rest, range of movement. Then we go on to proprioception, which is balance. So if you look on our Instagram page, I've done a few videos on proprioception, so how to build your balance. Very nice standard exercises that you can progress very, very easily. So we'll always start with just standard single leg balance stuff. Then we'll move on to a bit more movement. And then we will move from proprioception to just normal strength and conditioning. So working the gastroc, soleus, peroneals, tibialis anterior, and then we'll move on to your quads, hamstrings, and your glutes as well. It's very important when you do injure your ankle that you try not to limp as much as you can. Yes, it is very hard, and I've been there, done that. But it is really important that you don't, especially if you have injured your dominant side. Generally, then you'll create compensation onto your left side and you'll start having other issues. So for us, it's very, very common. We have a lot of people that have had lower back injuries, but then we've also found out in the past that they've also had an ankle injury. So what we'll generally do when we have our assessments is we'll look at someone's gait. So if someone's gait is altered, whether or not it's coming from the ankle or the knee, generally it will show a sign, or it will be highlighted to us. So unfortunately what will then happen is sometimes if someone's limping, you'll then alter the height of your pelvis and you'll have like a pelvic tilt. And then what that will kind of do is put more stress onto your back. So then obviously your injury not necessarily is coming in your back. Yes, you're feeling low back pain, but it might not necessarily have come from it. So for us, it's really, really important that when you do injure your ankles or your knees, that you do rehabilitation and you do it correctly, because otherwise you're just going to have an ongoing issue. Especially with ankles, if you don't rehabilitate them very well, you'll have the same injury again and again. It's very common in quite a few sports. I've seen it a lot with runners, and also with netballers and footballers, and a few basketball players as well. They've just kept thinking, oh, it's just a normal sprain, it's fine, I can just keep training, keep training, keep training. And then they just have a chronic injury where they just constantly keep rolling their ankle, as they've not strengthened their ligaments, they've not gone through proprioception, or anything like that. And they're just like, oh, it's fine, I walked off, it's fine, it's okay. There's a little bit of swelling, but a little bit of bruising, but it's fine. I was able to play and keep going, which is in hindsight okay, but you do need to let your body heal, and constantly overworking it means that it's not going to heal and it's not going to have time to rejuvenate itself. Um, so we want you to weight bear when you have injured your ankle. However, we don't want you to overweight bear and overdo it. As you don't want to have any knock-on effects, because if you have an ankle injury, it can lead to a knee injury can lead to a hip injury to a back. So it all kind of causes a chain of reaction that we kind of don't want to do. So yeah, as I was saying, once we come from proprioception, strength conditioning, we'll then move on to plyometrics. So we will always do plyometrics first before we will do running, as if you can't take one impact, generally you won't be able to take the impact of running, as it's repetitive. Yes, there's a little bit less force going through it. However, because it's a constant force, you're then going to be aggravating it more and more and more. So start off nice and simple, just doing single leg hops, and then we'll progress to plyo box jumps, and then eventually we will then go on to running, and then from running, acceleration, deceleration, we'll then move on to change of direction, and then returning to play. So that's the kind of stages that we follow. It will differ from person to person. Some people might need to work a little bit more on their proprioception and their balance, and their strength conditioning, and then because they're an athlete, they have quite a lot of good muscle memory. Same with avid runners, they can have quite good muscle memory, so then we don't have to go through it as much. But as I said, ankle injuries can be prevented. So I always say to everyone, whoever comes in with any sort of injury, it's really, really important that you do look after your ankles. So as I said before, the resistance band is probably my favorite thing to just prescribe people when they have ankle, knee, back injuries. Really simple, takes less than 10 minutes to do. You can literally do it sitting down on a chair, sitting down watching TV. You can be at work, you can do it. Like, there's no excuse not to just go through range of movement in your ankle, even if you're doing it without bands or without a towel, without any sort of weight or external force. It's still a good exercise to do, because you're still working those ligaments, you're still strengthening that area. So we always say work the muscles and the ligaments together. So doing plantarflexion and dorsiflexion, you're working your gastroc and your soleus, and then when you're doing inversion eversion, you're working your peroneals and your tibialis anterior. So, and also your gastroc and your soleus as well, but some will be a bit more active than others. So whenever you are doing those range of movements, they are not just working on your strength of your ligaments, but also on your muscles as well. So the stronger you are, the better it is. But balance is a very, very key one. So obviously proprioception will come in. So this is just how your body responds to balance, basically. So if you're going to stand on a platform, then that's fine. You'll normally be quite steady if you're on 2 feet. But then if you take that foot away, then all your balance will have to go into this side. So then your center of mass and center of gravity will change. And then what will happen is some people will kind of move side to side, as their ankles aren't very strong and they'll feel quite weak and quite unbalanced. So we always say to build that up. So it can be easy from just standing on one leg first for 30 seconds, then stand on one leg for 30 seconds, close your eyes, then you can take one step forward, or you can jump. There's loads of different ways to kind of go through it, or you can stand and reach for external force, or like what we have on our Instagram is Stand and Reach, and we also have the Y balance test. So for us, they're like general ones that we use as a good indication for how good or bad someone's proprioception is. Normally, the biggest one is standing on one leg and closing your eyes. Generally, people struggle with that quite a lot. Even I myself sometimes struggle with that. It's normal. You're just, when your eyes are closed, you're just like, oh, I don't know what's going on around me. So you just feel a little bit, oh, what's going on? But generally, if you can balance very well like that, then you can just start to progress. So we progress through using an unstable surface, so then we can use a towel, a pillow, and then we have a few foam pads, or you have stalk stands, or we also have a Bosun ball, which most gyms will have as well. So it's like a flat surface, and then it's kind of got half like a yoga ball on the other side. So you can have it on the flat side, or you can have it on the unstable side. Generally, I'd say the unstable side is a little bit easier to start with, because your foot kind of absorbs into it and then it kind of lowers. And then you've got the flip side, which is the flat surface, but because it's curved at the bottom, what will tend to happen is everyone will kind of go side to side. So generally it's a little bit harder. So I normally start with the soft side, then I move on to the hard surface. But that is available at most gyms, like I said. If not, you can just use a towel, a pillow, or anything like that. As I said before, generally all the injuries can vary on severity and how long it will kind of take. We would always recommend to anyone who has the same ankle injury, please do some form of rehabilitation. Even if it's a sprain and you just do 1 week to kind of understand what's going. Obviously, we would never say just do 1 week, but for some people it can just be, for them it might just be the difference for them, although the 1 week it will just kind of keep reoccurring. So for us, normally 6 weeks is a bare minimum that I'll do for an ankle injury or any injury, depending on severity, because then we're working on activation, we're working on the muscle strength conditioning, and then we're working on the actual stability as well. So that's all for today. If anyone has any questions, then you can ask them now. We will do a few more videos and Instagram posts a little bit more about what I've spoke about today. However, if anyone is experiencing an ankle injury and has been experiencing one for quite a long time, and like I said, does think that they are having referred pain somewhere else due to a previous ankle injury, then drop us a message, book in, and give us a call, and we will be more than happy to help you out and go through rehabilitation with you. So if anyone's got any questions, then ask them now. If not, then we'll end in about 2 minutes. Okay, I don't think we're going to have any questions today, so that's fine. So if anyone who's watching it on catch up, then just drop us a message in the comments, or send myself or Jodie a direct message, and we'll be more than happy to help you with any of your questions. And also, like I said, look out for posts that we put in the Facebook page and also on Instagram. Thank you everyone for joining me this evening, and I hope you all have a very good week. And I believe we have one more live next week before we take our little break for Christmas. So from me, Merry Christmas and a Happy New Year, everyone. Bye.